Michael is an extraordinary leader. He has that certain gift of combination of vision and realism, which both inspires the people he leads, but also gives them the confidence that the vision is actually achievable. And that has caused him to think very strategically about how he can better meet the needs of this area. And it's led to an extraordinary growth of the Carolinas healthcare system. And that in turn has driven tremendous job growth in our region.
So currently we have graduate medical education programs, physicians that have completed medical school that are coming to Charlotte to complete their specialty training. We recruit literally from all over the country. Professional people come to Charlotte, many of whom tend to stay. The School of Medicine will have a similar impact. Being a top 20 School of Medicine, we will recruit nationally, best of the best, brightest of the brightest, bring them into Charlotte, and hopefully retain a number of those people. So again, a huge economic driver. The very nature of building big physician practices, when you have hundreds of physicians in a network, every physician that you end up hiring into the network generates directly 4 to 5 jobs, 4 to 5 support people to support that physician.
With Carolina's healthcare system, you don't realize what an economic generator they are in terms of they're bringing people to Charlotte for treatment, they're bringing families to Charlotte who stay here, they are generating a tremendous, they have a tremendous impact on this entire region. The key is talent. Talent has children, and talent will come to Charlotte where they know that their children will get care the likes of which they won't see in other parts of the country. That wasn't really the case until the Children's Hospital was here and opened in 2007. So I think that is a tremendous example. Talent is going to go where those who mean most to them are going to be well taken care of, and they'll certainly be that here.
Well, we think of Queens as a strong economic driver for our community as well, and Michael's leadership on our Board of Trustees will help us determine the best ways in which we can educate our workforce and our population to meet the growing needs for health care in our community.
From a research perspective, it goes hand in hand. Research and education are linked. Today, if you look at the external research funding coming to CMC and UNCC in biomedical research, taken together, it's about $70 million in external research funding. That is already the size of a moderate-sized School of Medicine. So again, we're building on a very, very strong base. That $70 million creates jobs. It brings in professionals to the region. It spins off products and new ideas. Helps to attract additional business into the community. So there is a tremendous synergy that occurs when we start working together with the university system, with the research campus in Kannapolis. All those things work together to help to drive economic development in a major way.
Since Northeast joined CHS, we've seen a lot of growth in our physician network. We've added over 120 providers and over 33 new physician sites. We have broken ground on CMC Kannapolis, which is the first freestanding emergency department in Cabarrus County. We have also finished renovation of this new beautiful unit for post-surgical support care and expanded our operating rooms and all of the surgical support areas in our operating rooms, and are working on plans to further grow neurosciences and cardiology and cancer care in this region. We have services from birth to death, and we can do that because of his leadership. Mike Tarwater has created a culture at CHS that contributes to us, CHS, fulfilling our role as a regional and a national leader in healthcare. And that's what academic medical centers should do. That's what tertiary medical centers should do. And he really believes in that the size and the scope and the scale of our organization, we should reach out and help improve the status in communities around us.
We are on the national scene now, but under Mike's leadership, we're past the crawling stage and we're walking, and he's going to take us to where we are going to be running, and the rest of the world is going to be looking at how we did it. He has done a tremendous job.